If you're getting ready to start Medicare and you've decided to stay with original Medicare Part A and Part B, which I always recommend instead of choosing a Medicare Advantage plan, then you're likely now looking for which supplement makes the most sense to cover the parts that A and B do not. And I'm going to go through that right now. It's actually very simple for the most part, but it confuses a lot of people. But I'm going to show you the differences in the plans that would likely make the most sense. And there's a multitude of options, but there's really only a couple, really maybe three, that make the most sense financially from a value standpoint and from an out-of-pocket standpoint. I'm going to go through that right now. And I'm Keith Armbrecht. I'm founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. That's what we do, is we find the best value in your zip code and make sure we get all your pieces in the right places. Whether you're starting Medicare, whether you're already in Medicare, we just try to make it as easy as possible so we don't have anything to think about down the road. So we want to get it right, certainly from the start, and that's exactly what we'll do to make sure that things go smoothly for you and really take all the stress out of it. So people stress out over this completely, and it really, once you get it done correctly, it's terrific. So it's very good coverage, and we just want to make sure we get it right from the start. So right now we're going to talk about the choices in Medigap plans, which is the same as Medicare Supplement. And again, there's 11 or 12 or maybe even 13 different options, but really it comes down to two, maybe three, that really make sense. So we're going to talk about the difference, and you've probably heard of them before, Plan G and Plan N. I'll talk a little bit about GHD because that makes sense in some places where there are more regulations, but I'll explain that as well. And then at the end, if you stay with me, I'll show you exactly when I would pick which one, whether I'd pick G or N and why it makes sense. But let's understand exactly first how they work. And one of the best parts about Medicare supplements in original Medicare is the supplement plans are standardized. So they're exactly the same regardless of whichever insurance carrier we choose. So a G is a G, an N is an N, makes it really easy to compare apples to apples. And we certainly want easy. We want to find the value going forward so we understand and know what our costs will be as we get older and utilize healthcare obviously much more. Now, a little caveat to that, there are two states that decided that that wasn't a great idea. They're going to do it on their own. So you have Wisconsin and you have Minnesota, where a G is not a G and an N is not an N. They have their own formula, which I have no idea why they did it that way. I feel sorry if you're in Wisconsin or Minnesota. I do have videos specific to both of those states, and I'll put the link right below this video. So if you're in Wisconsin or Minnesota, don't watch this video. Watch the one that is in the description below. So, but back to everybody else, the plans are identical. And again, that makes it easy for us to understand what we're talking about. So if you've been involved at all with Medicare previously, in the past, Plan F was like the Cadillac of Medicare supplement plans. Pretty much the majority of people had Plan F, and there's a couple of different reasons for that. One, the benefit was fantastic. It covered 100% of everything. No out-of-pocket expense whatsoever. And that's good, but what it also does is it makes the premium too high because it covers 100% of everything. You need some kind of out-of-pocket expense just to keep your premium to where it should be. But the government actually made it so that Plan F is no longer available if you turn 65 after 2020. So Plan F is off the table, and I can tell you, it wasn't the plan to go to anymore anyway, because Plan G just made more sense from a premium standpoint over Plan F. But let's understand Plan G. So Plan F covered 100%. Plan G is exactly the same as Plan F. The only difference is it doesn't cover the Medicare Part B deductible, which right now is $240 a year. So if you have Plan G as your supplement plan, your entire out-of-pocket expense for the year is going to be $240. So Plan F was $0, Plan G is $240. And Plan G almost always is $240 or more less in premium than Plan F. So you can see that makes sense, obviously, to save the premium, take that deductible, and again, not a big deductible. You likely had a much larger deductible coming into Medicare than that $240. So that, in a nutshell, is Plan G. That's all there is to really understand. But let's back up a little bit and understand the supplement part of it and why I always recommend original Medicare with a supplement. So if you have that Plan G, number one, you don't have any network. You don't have to choose doctors out of a book to go see and figure out which one might take new patients, so forth and so on. Your network would typically be Google. You can go to any doctor anywhere in the country that accepts Medicare. You don't have to ask for permission. You don't have to get pre-authorization. You just simply call, and if they take Medicare, they will accept your Medicare supplement plan as well. They have to. There's no choice from them because everything runs through Medicare. When you're on original Medicare with a supplement, your doctor bills Medicare. The insurance carrier never has any interaction with the doctor or with you for that matter. Everything runs through Medicare. And if Medicare covers it, then the supplement has to cover it. There's no decision on their part. So it just makes things so easy when you're in a health crisis where you need to have something done. The last thing you want is for an insurance carrier to go, oh, well, you need to try these 3 other things first before we're going to pay for that. So you want health care that if your doctor says you need something and it's medically necessary and you agree, that's all there is to it. There's no complication. There's no forms that you have to fill out. It just makes everything really the way it should be with healthcare. So fantastic coverage and just keeps people happy going forward. So that's how a supplement plan works. Obviously, a Medicare Advantage world is completely different, where you have pre-authorizations and you have networks of doctors and hospitals that come and go out of the networks. Just it complicates things tremendously. And again, that's why I would always stick with original Medicare. Now, the different option is Plan N versus Plan G. So why would we choose Plan N over G? Simply if the premium justified it. So if the premium for N is significantly lower than G, then we probably want to look at Plan N. So the difference between Plan N and Plan G, it's kind of similar in how they function. So where G was exactly the same as F, with the exception of the $240 deductible, N is exactly the same as well, except it has that same $240 Part B annual deductible once between January and January, and then N also has a $20 copay for an office visit. And it's actually up to $20. A lot of times it's less than $20. So when you go to the doctor or you go to the specialist or you go to outpatient, it's a $20 copay or a maximum of a $20 copay. Not a real big out-of-pocket expense if the premium justifies it. Plan N also has a $50 copay if you go to the emergency room. So emergency room, $50, not a big copay, certainly not prohibitive to keep you from going to the emergency room. If that's your only out-of-pocket expense, then that's not too bad. Now, Plan G, there's no out-of-pocket expense for the emergency room other than the Part B deductible. But $50 copay, again, if it makes sense from a premium standpoint, then we're going to look into it. So Plan N, where it has a little bit of a gray area, does not cover what is called excess charges. So this is not something that is prevalent in most cases. It's actually very rare that it ever comes up, but it is something on Plan N. I'm not sure why they still have it, but excess charges fall under how a doctor is contracted with Medicare. So most doctors are contracted under Medicare assignment, and Medicare assignment means they agree to accept what Medicare is going to pay them as payment in full. Pretty simple. If they do not accept assignment, they're contracted with Medicare, then they can actually bill 15% on top of what Medicare pays them, which kind of sounds like a lot, but it really doesn't factor in, number one, very often, but it's also not a big number when it does for the most part. So if a doctor's office visit under Medicare, it might be an $80 reimbursement to the doctor, even if it's $100, then 15% would be an additional $15 to you. which again is not prohibitive if the premium justifies it. And there are also 8 states that don't allow excess charges. So if you live in one of the 8 states that don't allow excess charges, Plan N might very well make a lot of sense, because the only difference would be the $20 copay to the doctor, the $50 copay to the emergency room. So, but just understanding exactly what it is all about is the best way to make that decision. And then the last one would be a GHD, which is Plan G with a higher deductible. So the deductible on GHD right now is $2,800. And, you know, that's a big deductible. Why would we want to go from $240 deductible to $2,800 deductible? And it would only be because the premium would justify it. And there are a few states like New York, Washington State, California, where it does make sense because they've mandated some additional regulations or benefits to you, the consumer, which, again, sound good, stuff government does that they think they're doing the right thing. But what it does, it raises the premium significantly. For instance, in New York, plans where they would be $100 a month in other parts of the country can be $250, $300 a month in New York because of this mandate. So if you were in that situation, you would absolutely want to look at GHD. And there's a number of different reasons. I have a video specific on that as well. Just look through my video library on YouTube for New York plans, and just makes a lot of sense to look at that. But for the vast majority of people, we're talking Plan G or Plan N. So when would I choose which one of those that I would have? And it's pretty simple. It's based on the premium. And that, again, that's what we do. We find the lowest premium in your zip code, whether it's Plan G or Plan N. So Plan G can range really between $110 to $150 a month, depending upon the zip code. And again, depending upon age as well. If you're 65, it's likely going to be less expensive than if you're 75. So we need to make sure that we do a strong comparison to make sure that we find the best value. Plan N could be as low as $70-some and as high as $110. So the difference between the two when we're looking at them, if N were more than $25 less than G, I'm probably going with N. If G is is not more than $25 than N, I'm probably going with G. So if G is $120 in my zip code and N is $115 or $110 in my zip code, I'm going to choose G. And if G is $120 in my zip code and N is $80 in my zip code, I'm likely going to choose N. It just makes a lot of sense to take on that $20 doctor copay if I'm going to save $200, $300, $400 in premium over the year. So that's exactly where we want to be. And again, we just want to get it right now so that going forward, we don't have any problem. And again, best thing about supplement plans is we don't have any problems. I have thousands of clients and I don't get any phone calls with people screaming at me and complaining about this wasn't covered or they didn't pay for this or why is this doctor not in the net. It just doesn't happen. I literally, my phone doesn't ring, which is fantastic from a customer service standpoint. So that means we get it right. That's the best testimonial that I could give to why Original Medicare with a supplement is the way to go, because people are happy and I'm happy and it just works out great. So I hope this gives you a pretty clear understanding of the difference between the two. Give us a call. We'll walk you right through it. We'll make sure we find the best value. We'll make it easy. We enroll it. We get it all done, put it to bed, and then we don't have to think about it anymore. I'll show you exactly what that's about right now. I hope you downloaded my book. Have a fantastic day. Thank you for taking the time to watch my video. I hope it'll make things a little bit easier as you're trying to figure out all your Medicare pieces. Now, if you're going to stay with Original Medicare Part A and Part B and a Medicare Supplement Plan, G or N or GHD, whatever it may be, we can help with that. So that's exactly what we do, is we find the best Medicare Supplement Plan in your zip code. So if you go onto my website, MedicareOnVideo.com, put in your basic information, we will email you a quote with the best value in your zip code. Makes it very easy to do. You'll see right on my site below the box, we do not share or sell your information with anyone. But do be careful if you're filling out other websites. That's exactly what most of them do, is they take your information and they sell it to multiple agents and you're bombarded with phone calls. So we don't want any of that. We want to make it as simple and easy as possible. We have access pretty much to any carrier in all 50 states, so we can make it as easy as possible. If you want to get a little more comfortable, just Google Medicare on Video and look through my Google reviews. We just have a tremendous amount of very happy people that found it simple and easy to do and get the right plan that they're looking for. So it's in your best interest, and I get no customer service phone calls. So people are happy, I'm happy. It's a terrific way to do business. I certainly hope you'll allow us to help you. If you need anything at all, feel free to utilize my information on my website, my book you can download, and we'll do everything we can to make sure we get all your pieces in the right places. Have a fantastic day.